Whoa, President Trump, thank you so much for taking time out of your busy schedule to meet with me. My name's Sean McBride. I'm a registered nurse here out of Boise, Idaho, and I wanted to take a few minutes to talk to you about how important the expansion of telehealth services can provide for the citizens of this state and this country, along with those who we see far too late within the hospital. So, what telehealth medicine is, it's the use of technologies to deliver a direct patient health services to those who are geographically cannot make it to a clinic or a hospital, but there is a limitation to the amount of telehealth services we can currently apply due to both the lack of infrastructure or incentive on both the state and provider level to provide these telehealth medicines. According to a 2010 census of rural areas within the United States are home to nearly 20% of the U.S. population. Basically, 67 million Americans that could significantly benefit from this implementation of telehealth services in their community. The disparities of geography can be eliminated with the correct infrastructure and incentives for providers and states to implement these systems that can serve their communities both now and for decades to come. At St. Luke's, I see many times in the ICU, patients come in when it's too late. They come in when their symptoms have gotten to the point where they need to be admitted to the hospital. And a simple video call with a physician might have been enough to prevent these patients from coming in and using hospital resources that could have been prevented. For too long, healthcare has been about treating symptoms and not about preventing illnesses. And I think this is the route we should be taking as a country. Knowing that a child in rural Idaho needing to see a psychiatrist can have a consult in child psychiatry to help reduce the need for either psychotropic medication prescribing. It will prevent admissions to residential treatment facilities and reduce the cost of care significantly from having to go to the hospital, instead being able to hop on a phone call with their provider. I really like you to consider this policy with reimbursements for providers to incentivize these electronic visits, similar to what is already implemented during the pandemic, while we are also creating a lasting infrastructure of broadband internet usage for these rural and underserved communities. I really hope you take some time to consider how many American lives you can impact both now and in the future to improve the health of so many citizens, and ask your support to look for the future to prevent rather than treat. Thank you so much for your time.